Capitol Hill, Republican Senator from Wisconsin, Senator Ron Johnson. Senator, you ran effectively on a mission to do away with Obamacare. But when you look at these latest poll numbers suggesting that it's your party that's going to get the blame if the government shuts down, what's your advice to your colleagues?
Well, first of all, I'm a manufacturer. I come from business world, so I always look at the root cause of the problem. And the reason we're at this point today is because the Democrats jammed through on a 100% partisan basis a huge reform. They didn't do the work of trying to get a bipartisan consensus on how to do health care reform. Then, of course, Harry Reid hasn't. But listen, come on, Dr. Emanuel, please. And then of course, Harry Reid hasn't passed an appropriation bill in over 2 years, and so now he's reading the polls, and rather than keeping us in session, they're going to swat this thing away. Let's face it, they're going to swat it away. We should have swatted this bill away. Harry Reid should have taken a vote as soon as the House passes. So we actually gave ourselves time so we could avert a shutdown. I don't want a shutdown. I've been working with the White House trying to work on these enormous financial challenges we have in this nation. But let's face it, it's the root cause of the problem is that this is an incredibly partisan, very divisive bill, and we're dealing with that right now, and it's a real shame. I don't want it. I don't care who's in the White House. I want the economy to succeed. I don't want to shut down.
Let's go back to history.
Doctor. Now you can talk. I won't interrupt you.
We ran an election, President Obama versus McCain in 2008 on health care. Obama won. We worked for 14 months to get bipartisan support. There was 9 months until September 2009 where Senator Baucus was working with Senators Grassley and others to try to get bipartisan support. And we had one word from the Republicans, niet. We weren't going to play. And then we went it alone. We had another election, the 2012 election, on Obamacare. Obama won. The country has said over and over, we're going to support this reform. The Republicans have never given a coherent alternative that controls costs, expands access to everyone in the country, and improves quality. We have Obamacare, we have the Affordable Care Act, and it will go into law. And what you're worried about is people are going to like it, that it is going to solve the problem of access and cost. And that's why we have all the heated rhetoric.
Simply not true. Listen, since the health care passed, 3.5 years have gone by, and this thing still isn't ready for prime time. I mean, President Obama is doing things without legal authority. He's acknowledging the fact this isn't ready by delaying the employer mandate, delaying the income verification part of this. Listen, Doctor, I realize you're a smart guy. I don't think you know how to take over 1/6 of our economy and do it well. That's the reason I'm opposed to this thing, because this is going to do great harm to our health care system. It's going to bankrupt our budget further. It's going to really have an assault on personal freedom. So that's why I'm opposed to this thing. And Republicans have put out a number of alternatives. So a lot of the things you're saying simply isn't true. But what is true is that even the unions are demanding change, coming close to calling for the repeal. This thing is not ready for prime time. So we should do the responsible thing to do is, why don't we delay it a year? I mean, I think that really does make a lot of sense.
Senator Johnson, you just said that an aspect of the Affordable Care Act is an assault on our personal freedoms.
It is. Which part of my personal freedom?
Which part of my personal freedom?
The Independent Payment Advisory Board that is really going to ration care. And let's face it, President Obama said, if you like your health care plan, you can keep it. That is not true. Tens of thousands of Americans are losing the health care that they did like. They're going to be dumped these changes. There are so many broken promises on this thing, and that is what's happening here. And by the way, the President has no authority to grant Congress and their members of staff special treatment under this law as well. That is something we definitely ought to reject.
Senator, let's go back to that Independent Advisory Board for a second. There's no reason for it, because we've had a slowdown in inflation, and that board isn't going to meet, and it's certainly not entitled to reaction.
That gives me a lot of comfort.
As the law says, it cannot reduce benefits to Medicare beneficiaries. The second thing we need to say is Obamacare's already done a lot of good. The millions of children who are still on their parents' health care plan and getting health coverage. The seniors who have the donut hole.
By the way, that's something
closed.
we all agree on, and insurance companies agree with that as well. We didn't need to pass an overhaul of the health care system to grant that privilege.
If we don't have a mandate and have everyone in the system, we cannot get rid of insurance companies excluding people or charging outrageous bills for pre-existing conditions. That's the only way we can get all of those things. And again, the Republicans never had a coherent plan plan or alternative. Senator Cruz is
true. Dr. Coburn, there are tons of Dr. Tom Price. There are all kinds of proposals out there.
Can I ask Zeke a question? Zeke, can you just respond, though, to two criticisms that you do hear frequently about the state of affairs now? One is the idea that employers are dropping health care as Obamacare comes into effect, and the second is that employers are moving more workers from full-time to part-time to escape the effects of Obamacare. You read and hear a lot about this from the Republicans. You want to give us your point of view on that?
Yeah, well, on the second, on employers dropping to part-time, there have been a number of studies by different Federal Reserves, and all of them contradict that claim. What they show is that we have slightly more part-time people than we have historically, and that's mainly because of the recession, and the hiring back being part-time has nothing to do. No one has shown that it has to do with Obamacare. And actually, I've asked a number of senators a number of Republicans who've made this charge, name me 10 companies that have gone more to part-time, and I've never gotten a list of 10. Now, the second thing about employers cutting back. We have more than 5 million employers in this country. You've got Walgreens, which is not cutting back. What it's doing is creating a private exchange. You've got UPS, which is saying, okay, if your spouse has insurance, your spouse's employer ought to cover her, which seems like a employer responsibility to me. We're not going to see, I think, large shifting into the public exchange. And even if we are, at least now we have a way for everyone to get coverage, and the employers who do that are going to have to pay a penalty, and that would suggest that they're not living up to their responsibility. So I think we have a system that provides people their opportunity to get insurance, whether their employer does it or they don't do it. And that's really an essential element of security and freedom that the Republicans think people should have.
Nicole Wallace.
Senator Johnson, Nicole, I agree with much of what you said today, especially with Obamacare being the root, the event that brought us to the point we're at today. How do we, as the Republican Party, get back to our policy objections with the law, which is implemented tomorrow? You hear stories of problems from coast to coast, and away from all of this coverage of the divides in our party over Ted Cruz's tactic.
Well, Nicole, I was working with the White House to try and come to grips with our debt and deficit issue. I was working with House members to try and pass a CR early, before we even left for the break. We can make that point. At this point in time, my suggestion, let's face it, the House has got enough advice from senators, but what I'd like to see is a CR at the Budget Control Act levels, which let's face it, President Obama signed that bill into law. 45 Democrat senators voted for it. I want to see a rejection of that ruling without legal authority that gives Congress and their staff special treatment under the law. Nicole, millions of Americans will lose their health coverage because of Obamacare. Members of Congress and the staff are part of that population. But members of Congress and the staff are the only people, because of President Obama's ruling, that will get their employer to subsidize their insurance through the exchanges, because we're special people. I'd like to see the House attached to that rejection, to the CR rejection of that OPM ruling, and we really should repeal the medical device tax. I mean, 79 senators voted against that thing. That is stopped investment in medical devices. That is shipping jobs overseas. So we probably ought to start dismantling the most damaging aspects of the health care law, recognizing it's in place. We've got to start harming American people, and it starts with, let's not shut the government down. I don't want to harm the economy. I don't care who's in the White House. But that is really what Senator Harry Reid should have done by bringing us back early, as soon as the House voted, to vote on this thing, because this process is going to have to play out. But obviously, Senator Harry Reid is looking at the polls, realizing, well, they've kind of got an advantage. So he delayed bringing people back till 2 o'clock today. I think that's highly irresponsible.
Okay, gentlemen, thank you. We will have to leave it there. I can have a feeling this conversation is going to carry on between the two of you. Senator Ron Johnson, Dr. Zeke Emanuel, thank you very much. Keep it up on Morning Joe. We'll be right back.